This morning, the door-to-door investigation begins. Health officials, including a crew from the Centers for Disease Control, now in Dallas, in search of anyone who may have come in contact with the first patient diagnosed with Ebola in the United States.
The patient admitted to this hospital has tested positive for Ebola virus, the cause of Ebola virus disease.
According to the CDC, the unidentified patient traveled from Liberia on September 19th, landing in the United States the following day, September 20th. Doctors say he did not feel sick until the 24th.
The patient was visiting family members and staying with family members who live in this country.
Ebola is a virus that can affect multiple organ systems and can sometimes cause internal bleeding. Though symptoms don't appear for 2 to 21 days after infection, signs do include sudden fever, weakness, muscle pain, headaches, and a sore throat. The disease is also spread by direct contact via bodily fluids, only after symptoms begin.
This is not transmitted by the air. There's no risk to a person in this hospital who's walking or as a patient. There's simply no reason to be fearful of that.
Paramedics who transported the patient now quarantined. The ambulance used, decontaminated. It's cordoned off. There's some concern because ambulance 37 was used for 2 days after transporting the patient, though health officials saying it's okay. The city spokeswoman telling CNN the Dallas County Health Department has confirmed that paramedics did follow proper guidelines to avoid contaminating additional patients. So far, none of the crew members are exhibiting signs of the disease. This, as the CDC says, fellow passengers on that same flight from Liberia are likely not at risk. Still, doctors warn to remain vigilant.
I have no doubt that we'll stop this in its tracks in the U.S., but I also have no doubt that as long as the outbreak continues in Africa, we need to be on our guard.
So let me just accentuate again, Chris. On the 20th, this person arrived in the United States without any symptoms, was not feeling sick. 24th is when they started to get sick, but it wasn't until the 28th where the person went into the hospital and was put in isolation. The person did go to the hospital once in between, Chris. 2 days earlier, went to the hospital seeking care, but for some reason was not tested at that point, despite the fact the person had symptoms and had this recent travel history to Liberia, and there was this concern. So that's going to be an open question still, Chris. We got to get answered. 4 days where this person was sick before they went to the hospital, Chris.